This is Scott Porter, and I am the Senior Director of Channel Development on the Pharmacy and Medical Markets team with ECRM, and I am joined by Mike Cook, who is the Director of Sales for MarkeTouch, and we, actually I should say Mike, just participated in our Thought Interaction Pods, or TIP discussions, and he hosted a couple of conversations around a very important topic: implementing and sustaining effective patient engagement surveys. Very popular discussions. It looked like you had some robust conversations, and just wanted to get your thoughts on that. And again, just say thank you very much for participating and hosting.
Well, thanks, Scott. I appreciate it, and being a part of the Thought Interaction Pods. The discussion and the session itself couldn't have gone better. We were very pleased to see that the pharmacies were engaging with one another and defining and discussing their own best practices when it comes to patient satisfaction surveys. So thank you.
Yeah, it's fantastic. And it really is nice in that respect that it gives folks that are attending this specialty pharmacy session the opportunity to engage with folks on the same side of the desk, to talk about common issues, challenges, what's going on. And the beauty of the Thought Interaction Pod is that you could be sitting with, anyone at the table, and they can share as much or as little as they feel comfortable with. So it is nice in that respect that it gives folks the opportunity to do so. What came out of it in terms of the usage of the survey? How are pharmacies utilizing that? Are they effectively doing so? Where are the opportunities there?
Well, prior to coming to ECRM, we knew that there was a lot of different ways in which pharmacies conduct surveys, patient satisfaction surveys. And this show really just proved it. Each pharmacy was doing something a little different. Each pharmacy was managing it in a different way, either contracting it out to a third-party vendor or doing it internally. So it really is just confirmation of what we already suspected was going on in the industry. And hopefully some of the pharmacies took away some good ideas that they can go and implement and start practicing, which I think is happening. I think there was enough information passed on from one pharmacy to another that it'll start developing what are the best practices in this industry. Because I think truly that's what was lacking, is development of some best practices for patient satisfaction surveys.
Yeah, absolutely. How often do you think that pharmacies should survey their patient population?
Well, a lot of it is dictated based on the contractual obligations that they have with the accreditors and the manufacturers, but what we found is that is all over the place as well. Some conduct surveys once a month, once a quarter, biannually, or annually, so it's really all over the board.
And then I imagine the real challenge is, okay, now we know what the results are, how do we positively utilize this information to make a difference and improve outcomes in patient satisfaction?
Coming away with actionable data from a survey is so important. Why do a survey if you're not getting from it good data showing which patients are dissatisfied or what areas of your business are substandard or lacking or needs improvement? We found that a lot of pharmacies out there are conducting surveys and they're not coming away with actionable data, which is just mind-boggling.
Yeah, absolutely. Well, thank you again. Really appreciate you taking part and serving as a host in our Thought Interaction Pods, and look forward to having you attend and do it again.
All right. Well, thank you, Scott.
Yeah, thank you, Mike.